Aaron Griesheimer, there's a lot of talk about St. Louis County. Seems like the whole state talks about St. Louis all the time almost, but changing the way local folks are able, the local county executives, health department folks. You know, in my county, it's a third-class county, the health board can make the decision independently without the county commission. That's something I guess is being looked at. What is the best way for a county like Franklin County? Who should be making those decisions on how long you could shut someone down or have an order? How should that end up being?
You know, I think it's important that, as you pointed out, Mayor, that we have collaboration, you know, between the county commission and the health department to decide what's best for their constituents, what's best for the population as a whole.
So it's interesting to me, this is the debate of should you even be able to lock people down? Should you be able to shut down restaurants and businesses? But in an urban area, I always found it interesting. I thought Parsons' approach was especially good because in Butler County, Vince Lambie was not going to have any, and the people, even if he would have done orders and restrictions, I don't think the people would have done them, which would have made them not even take one seriously if it was really needed. In an urban area, they want that. That's what people want. Sam Page has caught a lot of flack, but I think that's what his people want. Quentin Lucas, he's caught some criticism, but I'm not sure that's not what people wanted there. The local control seems to have worked. What changes would you make to it?
The changes I would make, honestly, are a lot less practical at a state level. What I was really hoping for at the beginning of this campaign was really serious federal leadership, top-down leadership that included truly sending stimulus money to every American and every business that needed it in a way that was clear and easy to navigate. What we saw instead was a lot of folks who were getting shut down by their local entities but had absolutely zero fiscal help from anyone. And that to me was the real struggle. I saw businesses close. I continue to see businesses close in my community, and it's heartbreaking. I've seen jobs lost, and people do not have the financial support to go on. So while I do think, yes, local control, the way Governor Parson allowed, you know, mayors to make that call for their community, I think that was absolutely great for our urban areas. I just think our top-down federal leadership is what was lacking.
Your background is in public health. Mm-hmm. What did you think? Well, I mean, Springfield's been praised for their response, but you know, if you go down to Old McDonald County, I'm not sure that would have flown down where they shot the movie Jesse James.
Right, and you know, I think we can all acknowledge this is a very complex issue. To speak to my background in public health a little bit, you know, I think we need to take a step back and look at our funding structures for places like our public health, our local public health agencies. We rank last in the country for per capita spending in local public health aid. And I think that became evident this year. So if we want to talk about local public control or any of these things, I think it wraps up into where our priorities are, and not specific to COVID, but historically we need to make sure that people have the tools in their tool belt to respond when a crisis happens. We've seen it happen this year, it will happen again, and we need to correctly fund and resource the people making those decisions.
Prediction, will you pass a bill changing the exact mix of a local control for a health crisis in Missouri?
Yes, I think we will.
What do you think happens?
I think it happens, but I'll fight against it.
What do you think?
I just voted against it in committee, but it's going to happen.
You talk to the governor quite often. If we ask you your thoughts, what do you tell him? I mean, how's it, the way it works in Cole County and Jeff City, did that work?
It did work, and we need to keep that communication very open, and we appreciate the governor's openness to have the phone calls with mayors and other entities so that we are constantly in that communication.
I thought it helped him that it wasn't the first time he had been in contact with, not just you, I mean, you're down the street, but Quentin Lucas, Lyda Cruson, those are phone calls he'd been making and relationships he'd been building before this. He didn't have to make it in the crisis. He'd already had those relationships.
Absolutely. You have to have those built, and he made it a priority from the minute he became governor. The first thing he did was meet with mayors, and that's important. And especially now as we transition into the next phases of this pandemic with the vaccine and with different tiers and everything that goes along with it, and continuing to take precautions in a smart way so that we can get back out and hold events and do things. So that transition is important to keep that communication open.